Love these questions. So, how do you choose liposuction over abdominoplasty? And when you're looking at abdominoplasty photos, why do some people have a short scar and some people a long scar? So, first of all, it's important to understand the difference between the two procedures. So, liposuction is a procedure where we make small incisions, we insert a cannula, and remove fatty tissue. So, liposuction is a procedure that removes fatty tissue. So, if your tissue is thick, it will make the tissue more thin. Liposuction does not remove or tighten skin, although your skin can tighten after liposuction, especially if we use some adjuncts to the liposuction to give a little energy to the area. It still is not a skin tightening procedure, really, and it will not consistently or reliably tighten your skin. Now, tummy tuck, on the other hand, is a skin tightening procedure. So we are in control of the skin tightening because we are removing skin. So how do we pick? It really depends on what the patient has and what bothers them. So if you have just fatty tissue in the abdominal area, your skin is pretty tight and good quality, liposuction can be a great option for you. But if you have a lot of laxity or looseness of the abdomen, tummy tuck's really the best option. And also remember, with a tummy tuck, we're also able to fix your muscle diastasis. So if your muscles have split, we can put them back together with a tummy tuck, and that, of course, can't be done with liposuction. Now, there's people that would really be better suited with a tummy tuck, but they just don't want that. They don't really care if their skin's loose, and they may have a little extra fat in the area, and they would prefer liposuction. Now, just because you're a better candidate for a tummy tuck doesn't mean you have to have a tummy tuck. So I see patients all the time that just don't want to have the bigger surgery. They don't really mind the loose skin, but they do have more fatty tissue in the area they would like removed. So what that will do is it'll give you a smoother contour. If you turn to the side, you'll be narrower and the area will be smoother. It's not going to fix the skin though. So if you're someone that doesn't really mind the skin, you don't wear bikinis a whole lot, you're fine hiding it in clothing, that might be the right. And just to mention that doing liposuction on a loose abdominal wall is a riskier, more complicated procedure. So this is absolutely not something you should be allowing anyone to do other than a boarded plastic surgeon. So as for your question about the length of the scar, yes, it's going to depend on your anatomy and how much extra skin you have. So kind of the simple way to figure out how long your scar is going to be is to stand up and look at the tissue that's overhanging and chase it over to the side where that overhang ends. That's really kind of the shortest the scar can be. So it usually ends up at least that long, sometimes a little bit longer, in order to have a smooth contour and no dog ears. Hopefully that answered your question. Let me know if you have any more.